Okay. All right, I'm walking in and washing my hands. Okay, hi, Mr. Cole. My name is Hannah. I'm your student nurse. I'm back with your normal saline that the doctor had ordered to maintain hydration from your laparoscopic cholecystectomy. I'm going to double check your name and date of birth. Do you mind telling me that real quick? Thank you so much. So now that I've done my 2 patient identifiers, I'm double checking the medication that I have with the MAR for my final check. The 3rd check, my 1st and 2nd check I did in the med room, and upon doing that, I also checked for the medication's expiration date, sedimentation, and expiration. So, just to ask again, Mr. Cole, do you have any allergies to medications or any new allergies I need to be made aware of? Thank you so much for letting me know. So now that I have washed my hands, I'm putting on my gloves. I'm checking for the IV site. I'm looking for inflammation, extravasation, any signs of local infection. I've asked Mr. Cole if he has any pain in that area, checking for tenderness and things like that. So he does not have any of those. So what I'll do now is check for aspiration of blood. But first, I am going to scrub the hub for 15 seconds. So once 15 seconds is up, I'm going to go ahead and checking for that blood return, which I do see. So I'm going to go ahead and push in 5 milliliters of this normal saline. I'm going to leave the flush on and get ready here. So I've opened my bag and I'm keeping 2 things in mind, not to contaminate this or this. Okay, so I have my medication here and I'm going to go ahead and spike the bag. Okay. Hanging this up. Okay, and this clamp is already closed. So I am going to go ahead and prime that now.
Well, it's just like
That.
I either don't get this or
priming here, watching the fluid go through.
and yeah, it doesn't have
Okay, and I am checking this line for any bubbles, which I don't see. Okay, so then I'm going to go ahead and make sure this clamp is closed again. Switch this out.
Oh, so sorry.
Okay. And now I am ready to program the pump.
Wait, do you want to use my phone and I'll use my iPad? My iPad worked yesterday.
How did you do it?
I did it from the thing.
Oh, then I'll do that. Yeah.
Also, it's really good.
Oh, this is fun.
Okay, not a new patient. Yes, med surge. I'm channel selecting A. Guardrails, IV fluids, page down. I'm doing the 0.9% normal saline because that's what I have on my MAR. And yes, that is normal saline. The rate is 100 milliliters per hour. Volume to be infused. This is a 1,000 milliliter bag. And then I will hit start. But first I'm going to open my clamp. Waiting for the first drop. And I see that now. I'm going to label this tubing with my name, date of birth, and the time, name, time, and date. And then I have also labeled this bag with my name, date, and time. Now I will lower the patient's bed to the safest position. And once I have done that, I'm going to go ahead and take off my gloves, wash my hands, and I will document.